The number one question that baseball players dealing with medial or inside of their elbow pain have is, do I need Tommy John surgery? And the answer is most likely no, but learn what things might be going on as you listen to the rest of this podcast. My name is Dr. Michael Falk, and I'm a physical therapist at Kinetic Sports Medicine Performance and the host of the Milwaukee Sports Performance Podcast. And we're going to dive into baseball players with medial or inside of the elbow pain today. So the big concern that everyone has, because it's in the media, watching Major League Baseball, watching pitchers, are, do I need Tommy John surgery, right? This is the big concern of every player. It's going to be 12 to 18-month rehab, and no one wants to be out of baseball for that long and go through that process. So everyone is naturally and rightfully very concerned about that. So let's just review what Tommy John surgery is in the first place. So it is a tear of the ulnar collateral ligament, or the UCL, and then they use a graft either from your hamstring or from your wrist muscles to reinforce that ligament, reconstruct it to restabilize the inside part of your elbow. It can happen in one pitch, where you just throw one pitch, feel a pop, have a big injury, or it can happen gradually over time. This is particularly true in older players, where we can have that issue pop up from there. Most of the time, 9 times out of 10, I'd say, you do not need Tommy John surgery if you're just dealing with elbow pain for the first time as a baseball player. So what are the things that it could be? Based on your age, if you are a younger player, the most common issue is going to be little leaguer's elbow. Little leaguer's elbow is an injury to your growth plate. So effectively, the weak link of the elbow in younger players, this softest, quote unquote, or weakest tissue, is actually going to be the growth plate, the bone, not necessarily the ligaments or the muscles. As players get older, as the bones strengthen, then the weak link is the UCL or the flexor pronator muscles that are going to be more common. But if you're a younger player, 8 to 15, 16, even as late as 17 potentially, and you still have open growth plates, you could just be dealing with little leaguer's elbow, okay? And that is something that does respond well to a period of decreased throwing, rehabilitation, and then a gradual buildup with no surgical intervention needed. The other major concern, if you are dealing with inside of your elbow pain and you're maybe a little bit older, is going to be potentially a flexor pronator muscle strain. You've got the flexor pronator muscles. They run on the inside part of your elbow. They're going to cross and lay down right over that ulnar collateral ligament. And they can get injured too, just like you can strain a muscle in your calf or your hamstring, for example. You can strain those muscles as you're throwing a pitch. The forearm muscles are exceptionally active as you're throwing a baseball, and they help protect that ulnar collateral ligament and stabilize the inside part of your elbow. They're also going to be very active with ball release as you're actually coming through the ball and releasing pitches. You can strain those muscles, and that also is something that does not require surgery. It is something that needs to be rehabilitated and potentially a period of decreased throwing, but it will not require any type of surgical intervention. Next thing, you can just have a minor strain of that UCL. So that same ligament that, if it's completely torn, needs to be surgically reconstructed, can just be lightly strained. Now, what does that mean? If we have a ligament that has fibers and they're strung together like this, right? When we start talking about strains, there can be different varieties. So that complete tear is going to be those fibers come right across. Okay, a minor strain, maybe they just get a little stretched and there's no actual tearing. Maybe something that's in between, you can have a partial tear or a more significant sprain of that ligament. The first course of action with a UCL sprain, especially in a younger player, is going to be conservative management. So this is not something that you're going to want to get surgically reconstructed right off the bat. It is going to be something that is going to be suggested to have you take a time off from throwing, allow that ligament to scar down and heal, rehabilitate and strengthen around that ligament and stabilize that elbow, go through a gradual buildup process of kind of gradually exposing that ligament to stress, where then you're able to get back into a throwing program and return to competition without surgery. If you just have a more minor injury to that ligament, again, you will not need Tommy John surgery, especially right off the bat. You're going to be suggested to go through a conservative process. The final thing that we worry about on the inside part of that elbow is you have a nerve. You have the ulnar nerve that runs right back behind that elbow, and that can get stretched in the throwing motion, and nerves that get stretched can become very painful. Typically, this pain is a little bit different than the pain from a sprain or a muscle strain. It's often going to feel a little more burning. It might not stay as like local just to the elbow, but can actually go down the forearm, even into hands, into the fingers on the outside part of your hands. And those nerves do not like to get stretched. They can get very irritated. It can be very painful. It is, again, something that will not require surgery, especially right away. If it's something that you have an anatomic kind of variation that nerve gets stretched repeatedly, there is a minor surgical procedure where they can relocate that nerve, move it to the other side of the elbow where it will not get stretched in the throwing motion. That can be done, but it is not as significant of a recovery from as going through a Tommy John surgery recovery. But people do very well with typically just an initial bout of conservative rehab first. And then if it's just something that continues to happen over time, maybe pursuing that nerve transposition surgery at a later date. So how do you know which one of those things you are dealing with? You need to see a medical provider and get checked out, right? I can talk to you, I could learn a little bit more and share what we expect to see. Again, somebody that has Tommy John or like a more significant tear, that UCL, sometimes there's bruising, swelling, really painful to bend straight in the elbow. Gripping or weight bearing through the hands is often really painful. This pain level is very, very high, and any type of throwing is going to be really painful. Some of those other things, not quite as severe pain-wise, maybe more full range of motion, and often they report able to like do low effort throwing without pain. It's just when you start really ramping up, it starts to get a little bit more painful. So those are some signs that you might have one of those things and not like the more significant injury that's going to be right to a surgical option. But the truth is, the exact structure that is injured is important to know a little bit. It's good peace of mind for you. But the way that we rehabilitate them and treat them is going to be very similar. Okay, so we are going to get that elbow to be pain-free, which typically means a period of rest or relative rest. Like maybe you can still play catch out to 60 feet, just you can't go out to 90 or 120 feet without discomfort. So some type of pulling back of the activity that's irritating the elbow, getting it to calm down. During that time frame, we often see pitchers and baseball players that will have decreased shoulder range of motion. They will have decreased shoulder strength. They might have decreased grip strength. Maybe there's really inefficient core stabilization. Maybe we see restrictions through your thoracic spine. We have a bunch of things that can put more stress on your elbow during that throwing motion. While we're letting that elbow recover and decrease in pain, we want to work on all those things that we find that are kind of deficits and potentially contributing to the increased stress on the elbow. As we go through that process, that elbow starts feeling better. We want to get you back in the gym doing your normal upper body lifting and making sure that the elbow is tolerating that. Okay, that's typically going to be in the 4 to 6 week mark, depending on how significant that elbow pain is. Sometimes a little more, sometimes a little less. From there, we want to go through a plyometric progression after that. We want to start exposing that elbow to a little bit more high-speed stress, much slower than throwing, but a little bit more stressful activity. So this can be 2-arm med ball throw variations. It could be plyometric push-ups. This could be taking a plyo ball and doing different modified like dribbling or low effort throwing drills, just really getting some good gradual progressions of stress to the structure on the inside part of that elbow. We want to give that another 2 to 4 weeks, depending again on how long you're out of throwing and your time frame. From there, we want to go through a controlled throwing program. And this is where a lot of players make mistakes, because at this point your elbow feels really good. You want to jump right back into it and get back into games. But that's a mistake that people make frequently, where they go too fast at that late stage. So we want to get throwing again, and approach with throwing as we accumulate a lot of low volume, low intensity, high volume of easy throwing. So lots of throws at relatively low intensities. Then we're going to gradually progress the frequency, throwing more days per week, and then the intensity over time, which intensity is going to be velocity, distance, basically throwing the baseball harder. And we need to scale that program appropriately for each player, depending how long they were shut down or out of throwing, how significant that injury was, and how hard that player is going to throw when they get back. Athletes that are throwing in the 60s or 70s mile an hour might need a different routine than someone that's throwing in the upper 80s or 90 mile an hour range. Okay, so the truth is that no matter whether it's a minor strain of the flexor pronator mass, whether it's a little leaguer's elbow, whether it's a minor sprain of that ulnar collateral ligament injury, we are going to take a very similar approach with all of those injuries and go through that basic same progression. What is going to be different is each player is going to have unique needs based off what we see in their movement assessment, in their shoulder range of motion measurements, in their shoulder strength measurements, and in their grip strength. And this is where getting an objective, detailed evaluation by someone that's an expert working with baseball players is going to be really important. Okay, so hopefully listening to this podcast, watching this video on YouTube is going to answer some of those questions for you of, do I need Tommy John? Probably not. If I don't, then what is it? Those are the major things that we're going to think about when we're dealing with pain on the inside part of the elbow in baseball players. Do you find this helpful? We'd appreciate you to share with a teammate that might be dealing with this elbow pain, help them out as well. Always appreciate a review on the podcast or subscribing to our YouTube channel, where we're going to have more of these educational videos coming out over time. And you can always learn more about us at our website, www.kineticsmp.com, where we have lots of free resources, blogs, podcasts available. And you can also schedule a call with me if you want to talk through your specific injuries. There's a link on that website that you can check out. Hope you guys enjoy, and we'll see you guys on the next episode.